Good morning, everyone.
Good morning.
Welcome to the Hindu Physicians International monthly webinar series. My name is Dr. Adityanji, and I will be hosting the session. I am not able to have my PowerPoint come up. Does anyone see my PowerPoint?
Not yet.
Not yet. Okay. Well, okay, now
I
can
do see it.
you can see it now?
Yes.
Okay, welcome. Welcome everyone on the platform of Hindu Physicians International. And as I said, my name is Dr. Adityanji. And this is our
Welcome.
mantra, Sharira Madhyam Khalu Dharma Sadhanam. As physicians, we help our patients to take care of their bodies. So body is a temple, is the first temple that we have to serve. And that holds true for both our patients as well as our own selves. So today is Sunday, April 5th, 2026, and we have a distinguished speaker, Dr. Shivam Dubey. His topic of presentation is half education. But before I bring him in, what is Hindu Physicians
Yeah.
International? We are a faith based charity by physicians of dharmic origin to serve the entire humanity. We are a non profit organization registered in the state of New York as a non profit, as a 501(c)(3), and we focus on Sanatan concepts in practice of medicine as well as practice of humanity. Concepts like Vasudhaiva Kutumbakam, Manava Seva, Narayan Seva. We are very inclusive. We serve people irrespective of their backgrounds. We realize that there are multiple faith based medical charities that provide humanitarian assistance, disaster relief, charitable care according to their set of ideals and beliefs. There were hardly any Sanatani or Hindu medical charities available, so we decided to start this. And our main focus is to promote selfless service of seva to humanity under a dharmic banner. And that's the list of the board of directors. I'm not going to read every name. And then this is our International Advisory Bureau. These are eminent physicians who have served the humanity. And this is our executive committee. And as you see, Dr. Shivam Dubey is honorary director of Sanatan Dharma Education for Hindu Physicians International. Our latest addition was Dr. Depali Desai, who is director of outreach for Dharma organizations. We have some short term objectives that I already said. In our local communities, we want to foster seva activities, whether that is a blood pressure screening event, or it's a blood donation camp, or charitable medical care, etc. Long term objectives are to develop humanitarian assistance, disaster relief, focus on prevention, and prevent environmental degradation. Anyone who wants to join can go to our website and fill up the membership form. Membership is free. If you are already doing some charitable work, you can fill up the community seva project of HPI and get HPI certification. The project remains yours. You don't change the ownership of the project. You have total autonomy, but it gets the banner of HPI, which is good for your project as well as for us as Hindu physicians. Of course, we have a distinguished speaker series, and those of you who registered probably you saw this flyer with Dr. Shivam Dubey. Dr. Dubey is a Harvard trained psychiatrist. He's leading a global movement to bridge the gap between traditional education and inner mental well being. His work integrates neuroscience, psychology, and practical life skills to help individuals manage stress, build resilience, and unlock their full potential. He's co author of a book on neurosciences and Ramayana. He's also a member of the executive committee, as I mentioned earlier, as honorary director of Sanatan Dharma Education. So our focus is basically on seva. At least in my area, we have done some uh, seva activities. This was done by Dr. Rakesh Sharma in New York area. With Rotary Club, we had done some seva activity with Cleveland Food Bank. And of course, we have been doing some seva activities at Gathering Place, which is a cancer charitable activity. So there are some pictures of that. If you want to support financially the Hindu Physicians International, you can pay by PayPal, go to our website, or mail a check to our PO Box. We are a tax exempt organization under 501c3. And of course, that is Swasti Vachan. So, you know, I will let Dr. Shivam Dubey, when he joins for his lecture, maybe to do Swasti Vachan. So, without further ado, it's my honor and pleasure to give the platform to our distinguished guest and speaker, Dr. Shivam Dubey. Dr. Dubey, the platform is yours. Kindly start your presentation.
Namaste, everyone.
Namaste.
I'm sorry, sir, but I'm not sure about the Swasti Vachan.
That's okay. That's okay.
So, but if you share the screen, then I can read and do the Swasti Vachan.
No, it's okay.
Okay.
It's okay.
Okay. No problem. So, let me share my screen and start the presentation for today. Okay. So, today we will be talking about the half education. Can you guys see my screen?
Yes, we can see your
Yes.
screen.
Yes. So the half education concept, I'll discuss that first so that you guys can understand what is it. Since the industrialization of nations happened in UK and USA and other countries, school system, education system also changed because they needed education of the world, outside world, so that materialistic world, science, mathematics, geography, history, all these subjects became part of the education. And later on in 300 years, what has happened is that we have really mastered all these outer education subjects, that we have skyscrapers, we have rockets, bombs, AI, robots. So all this development happened in outer education, and the school system was also was implementing it. But during this time, what happened is that there is another education part which was about inner education, about meaning of life, about satisfaction of life, about how to deal with the challenges, how to deal with our mind. That education was left behind by the school, and it was taken over by the spiritual systems. It was left to be taught by the spiritual systems, which obviously over the time there are different religions came up and organizations came up who started delivering that inner education. But what happened is that that was not systematic, formal, and it also created a lot of divisiveness. Even today we have wars going on which have some connection to those spiritual education given, which caused identity so intense that people could even war or kill other people for that. So because of that lack of inner education given by the school system, there are a lot of consequences we are seeing right now, especially the mental health epidemic, because there is an imbalance between the outer education and the inner education. So that is what I'm going to talk about. And this education, I'll tell you, the inner education, to provide the inner education, first we'll have to understand what is this inner education that I'm saying that this is inner education. Secondly, if there is some inner education, what is the subjects in that education? Outer world have subjects like mathematics, science, geography, but does the inner world have any subjects that could be taught to anybody, any religion, anybody in the school? Is that possible that we have a curriculum for inner education? I would like to share here that in last 10 years, I have been developing that only curriculum. So it's not like just 1 or 2 years ago that I thought that I'll start this half education. It's a 10-year work of my life that I have invested in developing the inner education. And this inner education has 10 subjects. And currently, this inner education is implemented to 50,000 children every week. This inner education, we have done research on it. We have the results of the research that this inner education is currently implemented in 50,000 schools, more than 50 schools in USA, Canada, Pakistan, and Middle East and America. So this inner education that we are giving to schools and colleges, why don't we give it to physicians? Because the physicians are having burnout. So that's why last year we launched Mighty Champion Physicians, which is a program for providing inner education, the half education to physicians. Any questions on that? Otherwise, I'll just keep going. Okay. So
You're
the
doing good. Keep going.
okay, the half education, the medicine trained you to regulate the human body, but there was little education was given to how to regulate your body, your own body. What was taught in medical school is anatomy, physiology, pathology, procedure, system of care. But what was not taught was the emotional regulation, self-awareness, stress recovery, cognitive flexibility, inner regulation. So basically, medicine is teaching us about the outside world, but letting the inside world to be learned by accidents, personality, crisis, and our parents, our environment, and the society. But as you know, that in last 1 or 2 decades, these systems are also having problems. Family systems, migration, all these things are kind of causing difficulties in learning those skills, the inner education skills that we used to learn. But now we are not able to learn them from our environment. That's why formal education of inner world is needed. Inner education is needed now. So, as the Honorable Director of Sanatan Dharma Education for Hindu Physicians International, I would like to give my perspective from Sanatan Dharma Education also. Usually, when I give this talk, I do not go into Sanatan Dharma. When I give this, I have given this talk to other hospital systems. But today, because as playing the role of Director of Sanatan Dharma Education, I would like to give my perspective, and it's my honor. I feel blessed that I got this opportunity from Dr. Adityan that I can actually present this because it's very close to my heart. So, in the ancient wisdom, as we know, that body, your body, you are not just this body, which currently the medicines looks at you as material body. They look at your brain, they look at your everything, liver, kidney, but we are not just the body according to the ancient system. We divided the you into 5 koshas. First kosha, anamaya kosha, which is your physical body. And that is what which is taught. I'm going to also talk about that currently what we teach is physical body. This is taught in medical schools. But there is another kosha of you, which is pranamaya kosha. This kosha is omitted from the education, or not, or neglected, or not taught, and this includes the breath and life force. The next kosha is manomaya kosha, mind, emotions. This was also excluded except for the psychiatrist or psychologist. I mean, they know a lot about it, but otherwise the general population, men and women of the country, or physicians, are not taught about manomaya kosha, or how to manage it is not taught. Vijnanamaya kosha, your intellect and discernment, ability to take right decisions, is also not taught. Although we learn all these koshas, we do learn, but it's not formally taught. That's what I mean. Anandamaya kosha is the kosha of bliss, purpose, and meaning. So we burnout is what is happening because we are only taught about only one kosha. Four other koshas were neglected, and the time has come that we have to pay attention to the other koshas. And I will map it down. I will try to map it down to the koshas, to the brain and our body. And where is it located? Pranamaya kosha, you can see that hypothalamus pituitary axis and breath regulation and autonomic nervous system balance. That is where it lies. Manomaya kosha, learning about your amygdala, mirror neurons, emotional circuitry, and default mode network. That is where the manomaya kosha lives. Vijnanamaya kosha is the prefrontal cortex. Metacognition, your core belief. Prefrontal cortex is what makes us human beings, is the most developed part of our body, of our brain, in animal kingdom. Anandamaya kosha, that is where dopamine, reward pathways, purpose, moral injury, and meaning. So, and this, so now I'll go ahead with the presentation. I actually do have disclosures. I'm also the founder of Mighty Champions program, and I'm going to talk about that program. And I'm the founder of it. So there is actually disclosures. So I shouldn't say there's no disclosure. Today, when you see a doctor, if you're a doctor, you will see him wearing a white coat, checking Epic at midnight, and eating lunch standing up during rounds. What begins as a survival strategy, emotional suppression, hyperproductivity, can evolve into neural dysregulation, cognitive dulling, immune dysregulation, and even suicidality. We will take a layered, evidence based approach from the HPA axis to the health policy, and we will show how the antidote to burnout may lie in the forgetting clinical tool self awareness today. What if burnout, excuse me, what if burnout is not doing too much, but is not taking care of yourself? Something happened to my computer. 1 minute.
Yeah.
Yeah.
I can see the slides.
Yeah.
Okay. Now we're back.
How often do I stop and ask, what is the stress doing to my brain? How often? Anybody? Am I operating from some survival or from connection, which is the foundation of human being human? When I go to the work today, what is my operating system on? Is it a survival mode on or a connection mode on? It's a very important self-reflection question today. Guys, I will be asking a lot of self-reflection questions today, and self-reflection is a very, very powerful tool. Human evolution happens from self-reflection. The time you sit down and take a pause and think about yourself, think about what you do, what you don't do, why you don't do, how you do, how you don't do. That is how you improve. But today, in the world of distraction, it has become really difficult to have this pause. And then, even if you have this pause, you only have time to be thoughtless. To actually have self-reflection questions is not easy. So we have done this task in our education. We have created self-reflection question for humanity so that they can self-reflect and improve themselves. Okay, burnout isn't just a problem we treat in others. It is in living in our call rooms, on our email, in our inboxes, and sometimes in the mirror. Today, we'll take burnout apart using the same curiosity we would bring to an unfamiliar case. Let's trace it down. As we know, 50% of physicians report at least one symptom of burnout. According to a study in 2022, physicians have twice the suicide rate of the general population. Burnout correlates with increased medical error, lower patient satisfaction, and early retirement. Burnout affects 50% of physicians, increased risk of major depressive disorder by 50%, according to a study, and anxiety disorders also increase, cost healthcare billions annually. Quick gut check for you. If I asked your spouse, kids, or closest friend today, how burnout is this doctor? What would they say? If you guys want to write down these questions, or I can share in the presentation, ask your spouse today. Dr. Gupta, you definitely need to ask Dr. Gupta, how burnout is this doctor? Or
Hey, I'm retired. I'm over the burnout thing.
but
But it's possible that
huh?
my early retirement is linked to burnout.
Yes, yes.
So, sir,
So
mostly they won't say burnout. Instead of that, they will say, even the kids
uh,
are started saying stress,
hmm.
stress, stress. Even 5 years, 6 years, they're saying it's stress.
Are you saying that your kids are telling you that you're stressed?
Not my kids. I'm actually having only one son. It's a
Uh,
3 years,
uh,
6 month only.
uh,
So I'm a counseling
yeah,
psychologist.
yeah, yeah.
So I'm just checking with the kids. I'm just saying my
Hmm.
clients.
Yes, yes, yes.
Yeah.
But the question is, if you ask your spouse or kids or closest friend, how burnout is this doctor, what would they say? What is their opinion about you? Stress to
Okay.
disease pathway. It is very important to understand that it is very important to understand that you don't get mental health problems or stress right away. It starts at some point, and that is the point mental health education and Mighty Champions, the program that I represent, and inner education is built on, to find that point when you start getting stressed. What do you do to take care of it at that time? Some questions for you. How often do I feel calm, truly calm in my body? Have I mistaken constant alertness for professionalism? It happens very commonly in hospitalist doctors. What daily habits keep my stress response stuck in on? What is that daily habit? Is it I'm scrolling too much, or getting distracted too much? As we all know, evolutionary, the circuit that is created to take care of stress is hypothalamus releases corticotropin releasing hormone, and then pituitary releases ACTH, and then adrenal gland secretes cortisol. This is what keeps us alive. This is what keeps us taking care of things in emergencies or crisis. When you have a red code or blue code, that is what activates and keep you get the work done. That is important for us. But the problem is that if it is always on, you don't have a code blue, but your alert is still on. That is when the problem happens. That is when the chronic stress keeps your amygdala always activated and leads to release in cortisol, which ultimately suppresses the secretion of brain derived neurotropic factor. And we'll talk about it. What is that? Mesolimbic dopamine pathways degrade, causing anhedonia, lack of reward response, and eventual apathy. Actually, I would like to explain this better from this another slide that I have. Let me just go to that slide. Yes. So, do you see burnout? Can you see this slide?
Yeah.
Yes, we can see the slide.
Okay. Burnout is not a psychological state, it is a neuroadaptive progression. You start from stress, and then gradually your nervous system is now adapted. That will make you have problems later. So, when you have sustained cortisol elevation, your HP axis is heightened, you get something called allostatic load. I don't know if you guys know about allostatic load. That is what when the stress accumulates in your body. And the hippocampal BDNF declines and memory consolidation degrades. Then you get executive depletion. Sustained cortisol impairs your prefrontal cortex efficiency, which is your decision making system. Working memory decreases, diagnostic accuracy declines, and emotional reactivity increases. And then you have motivational dysregulation, and then you start having like lack of interest in things, and then later on rumination and exhaustion happens.
Looks like you're describing what happens in residencies.
Residencies, and depending on what kind of job you're doing, and
Right,
what kind of system you are working in, you in ICU or ER or a, or you we
right.
have all got coping skills, and we know and we practice them. But what is happening with the increase in distraction, people are not able to use their coping skills, and they feel like watching a real video about something may help, but you have to actually practice it and have to have education about it. Short burst cortisol is fine, but long, if there is long release of cortisol, that could even cause brain shrinking. Chronic stress can overactive amygdala, underactive prefrontal cortex. BDNF is brain derived neurotrophic factor, that is important for neurogenesis. So you guys are still learning every day. You are learning new things and making new neural connections, neurocircuit. But if you have lack of BDNF, your neurogenesis will decrease and your learning will decrease. So we're gonna uh, look at this burnout for physicians from biopsychosocial perspective. Biology is your biology. When you were born from the DNA given to you by your ancestors. Psychology is when you grow up and learn in your psyche, your core beliefs. And society is the society. What is that effect? And this all includes in the burnout assessment. So let's start with the biological perspective. Am I blaming myself for reactions that might be wired into me? What would I change if I respected my biology instead of fighting it? Guys, I mean, I don't know how much you guys are aware, but in America, if we have a lot of people who have depression, anxiety, and it's come down to even genetic genes, that there is a gene that actually if you have that, then you might have, you're more reactive to stress, so you may be biologically prone for that. And sometimes when even you will see that even very good doctors or very smart people are taking medications, and that is the reason that you might actually have the biological predisposition for having a mental health or reaction, the reaction you have. Some people are just, you are learning coping skills, you're trying to cope with it. But if you have a biological gene, then it makes you little more predisposed to that. So when you imagine you have that gene and then you are living and working in a hostile environment, that's like pouring gasoline on the fire. So it's very important to look at your family history. It is to, if anybody has depression, anxiety, then you might be predisposed and you might react like them. It's very important for physicians. When I present to hospitals, I tell residents and doctors to look at your family history. And another part of the biological is that your sleep, your exercise, your nutrition, this is also part of the biological. So we are looking at the biological factors that could create burnout, right? So for biological factors, you guys can do this today. You can find your sleep, gap in your sleep, nutritional gaps, efficiency, exercise deficiency, genetic markers. Knowing your biology, that is your first thing to start today. Then after that, so we talked about the self-awareness into biology. For figuring out this inner education that we talked about, is about learning about your biology, psychology, and sociology. So today, first we talked about the biology. Now we talk about psychology. What is psychology of you? Core beliefs, perfection, moral injury, imposter syndrome. These are 4 topics we'll cover in. What is core beliefs? When you guys were born, you were born with this nervous system given to you by your mom and dad. But when you grow up, you develop core beliefs about yourself, about the outside world and about rest of the things. These are deep unconscious convictions about selves, others, and world, and it's formed in your childhood. If you were constantly told you're not good enough, you may start believing it. If you're constantly living in war, like in Iran right now or in Afghanistan, you grew up there, you grew up with a threat in your brain that you are being attacked in the name of God or whatever you call it. Yes, sir. Any questions?
No, go ahead, please. We will take questions later on.
Okay, please note down the questions then.
I have a long list already.
Oh my God, you are barred. You are not allowed. I'm sorry. Actually, Dr. Gupta has been mentoring me, so I know he's gonna ask all the tough questions. And he asks me questions all day. So today maybe some other people can give me hard time. Not
All
you.
right. I'll give it to the.
Yeah.
Sorry, go ahead.
I hope I'm not doing too fast or too much. I mean, I'm just
No,
trying to
you're doing
cover.
great. Keep going.
Okay. So core beliefs are what makes us who we are psychologically. We grew up in India, we have our core beliefs. You grew up in America, you grew up in one kind of culture, another kind of culture, different parent styles. All this shapes your core belief. But the problem is there is no education about core belief. There is no assessment. There is assessment, but nobody knows about it. And that's what we bring in our inner education. The children that we are teaching and the physician program we help you understand your core beliefs. And that will make you empower yourself there, because then you can change. Let's go or move on here. Some of the core beliefs that people develop. Um, Um, it mainly happens when caregivers were overwhelmed or unavailable. That's very commonly happening in parents today, that they are not available for their children. Expressing need led to punishment, shame, or neglect. Emotional needs were minimized in children, then it could happen. In adult relationship, belief shows up as expecting partners to read your mind, feeling resentful when they don't, or they over functioning emotionally but never asking for support. So some of these beliefs we have as adults, and these beliefs take a toll on us and could lead us to chronic loneliness. Even in a committed relationship these days, it is happening that people are getting little, the reflection question: do I wait for my partner to guess how I feel instead of telling them? Some of the core beliefs very common in I know I have worked in America mostly, so I know this is very popular in America. The core beliefs: the physician may think I'm not good enough, if I slow down I will fail, I must just know everything, people will judge me if I don't perform, my patients expect perfection, colleagues don't struggle like I do, no one really understands. And the change, and there is a science of changing core beliefs, and this is the education we teach. You become aware about your emotional reactions, what you believe, and then you challenge them and convert them into positive. Like if you have a core belief, if you found out that I am not enough, you could positively reframe it: I'm growing and learning every day. If you see rest is lazy, you can say rest builds resilience. I must always know uncertainty is part of growth. So that the way you perceive things, way you believe things, that's very important. Okay, so now let's go and talk about perfectionism. This is a very big problem in current medical system, that perfectionism is belief that anything less than flawless performance is a failure. It's not just about self-worth to performance. Why are physicians vulnerable? Because they're selected and trained in
And
hyper-competitive
people who
systems.
are not speakers, mute yourself. A lot of background noise is interfering with our speaker's presentation. So, those who are not speakers, please mute yourself.
Is it possible, sir, that admin can mute somebody?
No, they have to do themselves.
Okay. There is another thing very common in American medical system is imposter syndrome, and that is linked to hyperactivation of the dorsal anterior cingulate cortex, which is the error detection center. We are always detecting error in ourselves, but when it goes beyond hyperactive, then it could lead to imposter syndrome. Perfectionism create chronic autosomal arousal. Even minor feedback triggers flight or fight. You're not able to take feedback. Why it matters? Unchecked perfectionism, cognitive rigidity is reduced, compassion, and avoidance of growth talks. Imposter syndrome checkup. Do I attribute my success to luck, timing, or other people? Do I feel anxious when others expect me to succeed again? Do I downplay praise or feel awkward receiving it? If you ever felt like this, then you might be having a little bit of it. What is most common than you think imposter syndrome is in physicians? When success feels like a mistake, despite achievements, you feel like a fraud. You fear about found out. External validation doesn't register internally. Achievements are attributed to luck, timing, or others being fooled. Hyperactivity in error monitoring networks, disputed self-reflection processing. So it's a fear-based distortion of your self-image. Moral injury, which is very common, and actually one of the research from New England Journal of Medicine have saying that moral injury is a big cause of burnout. What is moral injury? Silence trauma in medicine. Moral injury is when values are violated by systems. It's happened very commonly when physicians have to take decisions about patient discharge, insurance, dealing with insurance, that they feel they're forced to act in ways that conflict with their ethical core. It's happened very commonly with child psychiatrists actually, when they know that problem is in the parent and they have to medicate the child. It's a big, you are, whenever you cross this boundary, you may shove it off or think it's not there, but it is actually harming you inside. If you are really ethical or moral, we are all are. When we become doctors, we trying to help people, and then when we have to take decisions about life and death in ICU or other places, uh, it activates regions similar to PTSD. It's almost like a trauma to your brain that you have to participate in a system where you feel that care was not given. We just call it's just a system. That's what we call it. And just shove it off and move on. Have I ever done something professionally that violated my personal values? This is the question we can ask today. Do I sometimes feel I am part of a system that causes harm? Yes, a lot of doctors are thinking when they are going to lifestyle medication, fellowship, nutrition fellowship, system is changing. People are thinking like that when they're prescribing medication and certain things. Do I carry guilt about decisions I was forced to make by protocol? Very commonly, I see that I wanted a patient to stay for 5, 6, 7 days, and then you should say, you have 2 days, doctor, get him out. Have I stopped speaking up because nothing changes anyway? This is very common. Do I feel emotionally exhausted after ethically conflicted situations? Why are physicians vulnerable? Systemic barrier, force compromises from insurance and rushed discharge, lack of control in life and death decisions, ethical dissonance between personal values and institutional policies. According to New England Journal of Medicine, moral injury is a more accurate term than burnout in many cases. And we don't even talk about it. I don't know how many times you have heard about it. Another very, very important thing is the education of mirror neurons. There is something called mirror neurons. A special class of neurons allow us to feel what others feel without language. When you go and see a patient suffering, you feel it too, but you have to keep it intact and mm, you know get too much, feel too much. But when you're seeing those patients all day, you get exhausted. So not, it's an occupational hazard. At the end of the day, you have seen 20 patients, 15 patients in medicine, surgery, whatever you did, and some of those patients were emotionally charged or having sad situation, poor circumstances that affects your mind too, and you get emotionally exhausted than a person working in an office or IT job. As a physician, you are more prone to this kind of burnout. That's why doctors are considered, you know, almost like God. And there is a science about it. It's not just I'm making it up. There is the circuits, inferior frontal gyrus, inferior parietal lobule, which actually does that for in your brain. Evolutionary, mirror neurons were very important, because if we did not have mirror neurons, I will not feel your emotion. Then how will I have empathy, compassion? How will I connect? But when over exhaustion of mirror neurons happen, you won't believe how many psychologists I see as patients. You won't believe it. All day, I see psychologists who are exhausted from listening the terrible stories. 10 patients they see them crying, trauma, death, and at the end of the day, their mirror neurons are exhausted and they almost become numb. And sometimes patients will say, my doctor is just say yes, yes, no, no, because they don't have that. They're exhausted. Okay. And like I said, it's very important. I already talked about it. So it causes bluntness. Do I still feel my patient's pain, or have I gone emotionally numb? That's the checkout question for your own mirror neurons. Have I been praised for staying calm when I was actually disconnected? That there was a team meeting going on and I was not even there. What would I it feel like to reconnect without losing myself again? It's a very, very interesting question. Mirror neuron dysregulation. Signs you may feel if you have emotional flatness during patient stories, feeling nothing when you used to feel deeply, decreased facial expressiveness or warmth, going through the emotions without emotional engagement. Okay, guys, so as we talked about all of it, now I will come to the solution, and which is, like I mentioned, is the education of inner self. Because if that education is not given, we are just learning by accident. There's no formal training. And as we know that pranayama, we talked about this, all the koshas, and they are all trainable. They are trainable. That is very important message I want to give today, that these all these koshas and the education of them is not is neglected, but it was always there, and now we are bringing them forward. The half education, why I'm saying the half education, because the outer education is given to you, but so far whatever I have talked about, that education was not given formally, although we have learned it. The solution is not just education, it's experiential education. And that's what we have tried to build our inner education curriculum that we are teaching to children and physicians and men and women is experiential. Before you leave today, name the kosha that is most neglected in your life right now. Is it your pranamaya kosha, your breathing, your autonomic nervous system, your vagal tone? Is it your manomaya kosha, your thoughts, your memories, your chitta, your manas, your thoughts, or your buddhi, your intellect, or your ahankara, your ego? Name one inner skill you were never not never formally taught. Name one practice you will begin this week. Self-awareness is not the reward at the end of healing. It is where healing begins. According to Tratiya Upanishad, Ya Vidya Sa Vimukti, that which is true education is liberation. So we have to, the solution is Mighty Champions Physician Program, which is bringing the inner education program for clinicians. Okay, let me go to my first slide now. Yes, the education that built your clinical mind left your nervous system untrained. It's scientific case of the other half education and what happens when physicians finally receive it. 54% according to AMA 2022 study meet burnout criteria. 400 plus physicians die suicide annually in US according to JAMA article in 2022. More than 500,000 cost to health system per physician lost to burnout. You were trained extensively in pathophysiology, but you were not trained in how to regulate your amygdala, how to use your prefrontal cortex, moral injury, cognitive bias, and a lot of other things that I talked about. The data is unambiguous. It's increasing. It's increasing every day. And according to latest article by New England Journal of Medicine, $4.6 billion annual cost of physician burnout to US healthcare system, and we still do not have any curriculum for our medical students when they go to medical college. Burnout is not a psychological state. We talked about this, how the burnout happens in your body. What is the clinician nervous system is dysregulated, patients pay the price. Study from Mayo Clinic in 2018 shows that increase in diagnostic error 36%, malpractice practice increase 45%, patient satisfaction decrease 61%, prescribing errors, empathy ratings, all and others. 5 neurocognitive systems that medicine never trained: amygdala activation, moral injury, DMN overactivation, prefrontal cortex fatigue, vagal tone, and cognitive bias. Regulation training produces measurable clinical outcomes. I'm not just making it up. We have done a study on 50 on for our program. And also we have publishing a research paper on physicians. 40 doctors are currently trained with our education, and we are almost going to publish a paper on that. Regulation training is already there and has been shown multiple times in studies at Mayo Clinic and research publications, which shows that if you teach them, then it will help. The half education, the education medicine gave you was excellent. It was also half of what you need. What you need is neurocognitive regulation under clinical load, moral injury processing and recovery, vagal leadership, and team neuroregulation to make you a complete physician. These are the modules that we train in our education system: neurobiology of burnout, prefrontal cortex preservation, allostatic load, dopamine and motivation, DMN rumination, moral injury, cognitive bias under pressure, empathy fatigue, vagal leadership, identity and perfection, the regulatory clinician integrated practice. It's not just a curriculum. We have live sessions that we run, and it's the biggest investment an institution can make. In medical school, we can have curriculum integration in medical schools. Our curriculum. And in institutions, hospitals, we can have this curriculum, and I would like you to experience it first before we can let's see. Yes, so I will stop sharing my presentation now. Just one thing I would like to show you. It's very, very important that for any education system, if we are claiming that we have the inner half education, do we have any assessment? Do we know what is the level and where you stand today in your inner education system? With 10 years of my life's investment into this, I have created the assessment systems for teenagers, men, women, and physicians. And this is the what I'm sharing with you. This is the, can you guys see my screen?
It's gone now.
Oh, I'm sorry. Sorry,
I think
sorry.
you stopped sharing when you
Oh,
closed your
yes,
PowerPoint.
yes. Let me just share one more time and then we'll be done. Just one more time. Okay. Share. So this is the physician burnouts assessment of the half education. Because if I'm claiming that all of you were trained in half education, then what is the other assessment of that other education? This is the education, and I would like to read it, and then I will share this link so you all of you can take this assessment at home and share with your colleagues. So far I have got really good feedback from the residents and physicians about this assessment. From early education onward, we were thoroughly trained to navigate the external world, academics, productivity, competition, and professional performance. Far less attention was given to systemically understanding and training the internal systems that shape how we think, react, decide, and recover under stress. The half education refers to dimension of self-regulation, neurobiological awareness, emotional management, and burnout prevention. Before moving forward, this assessment will help you determine where you currently stand in your knowledge, because you definitely have education as you grow up uh, from not in formal way, and practice of internal education. Your literacy in the mechanism that govern your own mind and nervous system. This assessment is not to test medical knowledge. It evaluates neurocognitive awareness, emotional regulation under load, executive control, resilience mechanism relevant to modern medical practices. Physicians operated high cognitive demand environments involving chronic stress activation, decision fatigue, moral injury exposure, and emotional labor. Many of these processes involve amygdala activation, prefrontal cortex modulation, dopamine revergic reward systems, stress hormone accumulation, and default mode network dynamics. This assessment identifies your current level of internal regulatory system, not your intelligence or clinical skill. You can pick one of the thing. You can pick practicing clinician or resident, and then you can start, and then you sign this consent. Everything is anonymous. We are not asking your email address or anything. It's just we are giving for the humanity or for the physician's welfare, that they can check themselves. And then when you click here, your assessment begins, and it will, in the end, it will tell you the score and where you stand. And hopefully you being true to it. Because a lot of times I had people do it, but they were actually not true to it, and you have to actually sit down and spend some time and look inward and do this assessment. And thank you very much, and namaste.
Thank you very much indeed, Dr. Shivam Dubey, for an excellent presentation on the other education, which deals with the spiritual, moral, and self experiential education that lacks in the medical school curricula. You did an excellent presentation. This is just a beginning. What we are going to do that we have 6 minutes left, so we will open it for question and answers. And your physician assessment questionnaire we will circulate on our WhatsApp group so people can have access to it, even a larger number of physicians, except for those who are present here. So I will work with you and I'll make sure that a larger number of physicians are able to benefit from it. But we have 5, 6 minutes left. So let's have question and answer. Those who want to ask questions, kindly unmute yourself and turn your video on. Looks like Dr. Anup Kumar wants to ask a question. Please go ahead, sir.
Well, if nobody is going to ask, I won't ask a question. I'm just going to share my own perspective. सभी कर्मचारी दफ्तर आने के लिए साइकिल का इस्तेमाल करेंगे। इस आदेश के पीछे ऊर्जा संकट का हवाला दिया गया है। आदेश में कहा गया है कि अधिकारी अपने खर्चे So I did attended a physician burnout special 2.5 day retreat with Advent Health in Orlando. The data from Advent Health physician burnout surveys showed 90% of physicians are showing evidence of uh, burnout. And there were two glaring examples, which Shivam, I must thank you for bringing both of those two out. One is this moral injury concept. Most of the physician, at least in my age group or maybe one generation, they all wanted to help other people. And the system of medical practice has evolved into so much corporate greed that most physicians are doing things that they don't want to do. They know it's not helping patients, but they are forced to do. That moral injury is a real thing. And many of the physicians verbalize this emotional apathy, that they want to help people, but they can't help them. And that generates very serious, and then they just give up and say, okay, I'm just here to see patients, write some script, and go home. And they've lost that passion that brought them to medical field. So thank you for bringing those 2 points. And um, I have taken that survey, and obviously right now I am retired, and I was just telling Shivam that obviously I'm scoring very high. That means I'm not burned out. I'm pretty healthy because I'm not practicing anymore. But if I have taken this 5, 10 years ago, yes, it was a significant burnout. And when I reflect back, it's possible my early retirement was linked to uh, burnout because I am a neonatologist. It's a very challenging situations every day. And after 35 years, I'm sure it has a toll on me. So,
Dr. Gupta, you have any question for me?
uh, what I
I
want
have a
you
question
to
if
see
nobody has.
how effective this course that you have designed, how we need some either anecdotal cases or some published
Yes, we
research.
yes, we do have lot of people have see, it's not something that you can have a cross sectional, you have to have a longitudinal work done for that. You
Correct.
have to follow that. It's not like I tell you something and you just out of burnout. It's a follow up process. It's going on. We started 1 year ago and we are still learning more and more about it. So far, what results we have gone is that everybody is thrilled and enjoying it and learning from it. Definitely education, but until it becomes a practice, it will be a difficult. And for that, we are actually launching a campaign called Mighty Champions Daily Live, in which every day for 1 hour we will hold a live session for doctors anywhere in the world. Globally, doctors can attend it. Shreya,
That's awesome.
Thank
do
you,
you have a
Dr.
question?
Dubey. Uh,
Yeah.
one more question from Dr. Shrisha. She wanted to say something, so we'll let her ask the question.
Yeah, sorry, I'm not a doctor, but I had a question. That was a very, very brilliant presentation, Dr. Dubey. And much needed, because I worked in hospitals or the admin side, and I've seen doctors struggle, right? And I feel it's the best human beings who go into medical saying, I will help humanity, I will help alleviate pain, but then they are forced to do things that is against their values. So my point is, how do we actually implement this at scale? Can we speak to American Physicians Association, Medical Association, in IMA, Indian Medical Association, and we need to actually bring this in at medical college education level. It has to be one of the modules. So is that something we all can look at?
Yes, we are trying to bring it forward for the residents and physicians and fellows and practicing doctors, and it's a very, very challenging task, but we are trying to gradually do it and moving forward with the research.
Next question, Dr. Ravi has raised his hand. Dr. Ravi, kindly unmute yourself and please ask your question.
Yes, thank you. It was an excellent talk. There's a lot of talented people here, and there's high prevalence of mental illness in certain states in the United States. Is it possible to talk offline to come up with a group idea that can be proposed? Because I see neuroradiology, psychiatry, psychologists on this talk. The other thing is there's a lot of sleep that I feel is ignored by psychiatrists. So it's a lengthy, complicated topic. Rather than taking up everyone's time, maybe we could discuss this offline if you're interested.
Dr. Ravi,
Yes.
great suggestion. I would suggest you go to HPI Hindu Physician International's website, fill up the membership form, join our WhatsApp group, and we will work with you. We'll work with you.
Thank you.
Okay. Okay. Any other question?
Yeah.
Yeah, I want to add one thing here. Thank you for this presentation. When the conversation around burnout happens, or more recently reframed as moral injury, one of the things that we tend to do in medicine is that we frame it as a culture issue, right? So, maybe our preceptors, the attending physicians, when we were residents, maybe they were a certain way, maybe medicine was looked at different way. Now the culture is changing. It's more about wellness, healing. I think we need to look at it also as a knowledge issue. To really reach physicians, you have to look at it as a knowledge problem and not primarily a cultural problem. And I think you have to look at it actually as a scientific problem to reach physicians, right? Because our identity as physicians is based in medical science. And that medical science, as we know it, is an incomplete science. And I think it's important that we look at specifically the core of it is the philosophical foundations, specifically that brain-mind connection, and really even deeper, the consciousness and matter connection. And there is this unexamined, undeclared bias in medical science that says matter is fundamental and consciousness is secondary. Whereas that is actually a philosophical position. It's not a scientific position. It's philosophical. But we assume it is science and everything is based on that. So I think it's important that we look at those foundations and say, hey, there is a knowledge question here in addition to a culture question that we need to ask and bring those points out as well to educate physicians. So I'm wondering if there's a way that we can pair these ideas that you're putting forth about looking at the brain-mind connection, about looking at a spiritual view as well as a scientific view, but also seeing that there's a deeper knowledge question that in fact is not unique to medicine, but all of education that assumes this relationship about consciousness and matter that is philosophical and not scientific.
Dr. Dubey, you want to address that?
Yes, sir. Well, if throughout my presentation, I started with this foundation, the education, the half education, I think my presentation should have answered some of your questions, because our campaign is not a treatment or therapy or a diagnosis. What we are doing is providing the inner world, the skills that are needed into an educational framework. and giving this education, and also created the assessment for it. And you will see that I have constantly put forward the research that was done, which is based on what we have created. Even the physician assessment that you will, if you will do, sir, you will see that it's totally scientific. There is nothing spiritual I have talked about in my, and I have not touched the spiritual system yet. But I will tell you that in University of Virginia there is a department about the consciousness studies, which have 2,500 noted and investigated, formally investigated cases, which have shown the reincarnation stories all over the world. And it was done by two child psychiatrists and published the research in Frontier of Medicine, Frontier publication in journals like that. But it was totally ignored or neglected or whatever. So science evidence is there. We have to gradually go in through our from scientific perspective. That's why we have created this inner half education, and our goal of this education is self realization. That is our final goal. This step that you're seeing is the first step, foundational step, that will take them towards inner education. The next course that we will launch after this will be going towards the self realization, which will bust this myth that you are just a material, but make you understand that material is your slave.
Thank
You
you,
are
Dr.
not the
Dubey.
material.
Thank you, Dr. Dubey, for addressing the comments Dr. Anup Kumar raised. And I don't see any divergence there. I see actually harmonization of two different viewpoints. So it's a kind of complementary to each other. These comments made by Professor Dr. Anup Kumar are very, very relevant. We are running short of time, but this discussion does not end. So, first of all, I would like to thank Dr. Shivam Dubey for his excellent presentation. But I will also take this opportunity to invite any of you who want to come on this platform and deliver a lecture, specifically, actually, without putting you on hot seat, Dr. Anup Kumar. I would be very interested in arranging a lecture by you on mind body connection and education deficit. We can work it out offline,
Sure.
but you have raised very important issues. And if anyone else is interested, please work with us. I will make this platform available to anyone who wants to deliver a you know lecture on a topic either too neglected in our traditional medical system. And also, again, our focus is on seva of humanity. If you are doing a local seva project, please come to our website, fill up the local community seva project form. You retain your complete independence in conducting the seva project, but you get HPI banner and HPI certification.
Can I
And
make a comment, Aditya?
can we just try to wrap it up
Very
now?
briefly,
Okay, go ahead.
I just want to thank Dr. Anu for bringing that very important point. In fact, Dr. Shivam and I are doing a lot of work how to integrate and bring spirituality into education. And I think that is coming through the mental health programs that we are envisioning. And we can talk offline about a lot of projects that we are doing in, especially in that regard, about the downward causation philosophy, that from the spirit comes the mind, from the mind comes the physical body, not the upward causation that most of the medical school and contemporary scientists talk about.
Thank
So
you, Dr. Salil Gupta. We have to end this session, so we will be open to feedback individually and we will be willing to host you for another lecture. But please do your seva projects. If you wish to support Hindu Physicians International, please go to our website. You can donate by using PayPal, you can donate by writing a check, etc., etc. But please stay involved. We are having an open platform. We want to present opportunity to discuss things that are not hitherto discussed in professional circles for physicians. So thank you again very much to Dr. Shivam Dubey. Thank you to all our audience members on a Sunday morning. Finding an hour, 15 minutes is a challenging task for physicians. So thank you everyone, and we shall reconvene in 2 weeks' time. And I think Dr. Lakshmi from Boston would be our next distinguished speaker, but I'll work with her. And again, Dr. Anup Kumar, we will host you for a follow-up session on this, and we'll continue to work on this. Thank you very much indeed.
Namaste sabko.
Thank you,
Namaste.
everybody.
Thank you, Dr.